And like, what side effects should we keep in mind while we are Kutki, maybe in higher dose or for a longer period of time?
Only thing is higher doses, it may some sort of watery motions or purgations, or in certain patient, it may cause some gripping pain. These two things to be kept in mind. Otherwise, nothing to worry.
What are your favorite medicines containing Kutki that you use on a regular basis, sir? I'm sure that you have, I mean, you are an advisor for Pentacare, and Pentacare has a Kutki capsule.
Yes, we have a Kutki churna is there. We have a Katuki tablet is there, and we have a Patola Katruhini Adi Kashayam is there. Cheka Kwata is there, and we have one capsule called Immunup. It also contains Katuki. So there are plenty of combinations are there, and of course Arogyavardhini is one of my favorite drug, which contains a lot of Katuki in it. And of course, even I use one drug Amrita Bhumi. It is also containing Katuki.
Whenever we talk about, say, ashwagandha, so it's balavardhana, immunomodulator, immunoboosting. So we tend to keep certain herbs in certain baskets. So bala is there, so Shirvara Thaila, Narvine tonic and all. But this Katuki is almost like spread across widely. Like it's there in fever, Shwasakasa, Arsha, Vedana, liver. So it addresses many organs and many systems at a time.
But we need to understand, we can't simply give Katuki in every jwara. Just like how pan jwara is there, we can use ruchi. Similarly, we don't use Katuki. We use Katuki in a very peculiarly where there is ama and where there is a very clearly which is related with the where we feel that it is from the liver and gallbladder, or it is associated with Agnyashaya or Pitta Pradesha, or even from the upper portion of the colon. If these areas are involved and jwara is manifested because of the disturbance or the doshic disturbance at these levels, then Kutki is used in that condition. It's not simply that we have a headache and cold body ache and jwara, it is there. In that condition, we don't use Kutki. We have better drug in that cases, like Mahasudarshana Kada is there, Mahasudarshana Vati is there, or even Tribhuna Kirti is there. So that area, that disease, that condition is entirely different, and accordingly we use in different drugs for that condition. Katuki is very specifically we use it where we feel it. Katuki, for example, pancreatitis, cholecystitis, hepatitis, or any duodenal things. We will feel that jwara, which is due to some infection in the colon, enteritis. In these conditions, if liver is involved, or we can say that it is yakrit, pleha, and these type of organs are involved, then it is better to select Katuki over there. So we need to be very specific in selecting, because there are certain drugs which are very much target oriented and tissue oriented are there. We need to use them accordingly.